Greetings, my name is Dr. Irwin Goldstein. I am Director of Sexual Medicine at Alvarado Hospital right here in San Diego, California. We have developed a series of educational videos about the surgery, penile revascularization for erectile dysfunction. We have reviewed such topics as surgical techniques. We have watched a young patient with bicycle riding erectile dysfunction go through the surgery, and we have examined the relationship between blunt trauma, such as that from bicycle riding, and its relationship to blocked arteries to the penis, leading to erectile dysfunction. In the seventh educational video, we focus on a unique patient population of young men with erectile dysfunction. These men have so-called primary or lifelong erectile dysfunction. These men have had erectile dysfunction their whole lives. The first segment of this video will provide evidence-based scientific data concerning the prevalence of erectile dysfunction in young men. The first slide introduces the topic of lifelong primary erectile dysfunction with its association to blunt perineal trauma associated with bicycle riding. The second slide reviews a larger study of almost 12,000 men, of which half completed a validated assessment of their erectile function, entitled the Sexual Health Inventory for Men, abbreviated as SHIM, S-H-I-M. Based on these data, it was estimated that only 1% of young men aged 25 to 80 had severe erectile dysfunction. 7 times more men at this age had a moderate form of erectile dysfunction. The third slide emphasizes that of these young men who had any form of erectile dysfunction, less than 5% seek medical help. We hope that these educational videos will encourage young adult men with sexual health problems to seek multidisciplinary biopsychosocial diagnosis and treatment. This next slide allows us to comprehend how many young men there are who may have erectile dysfunction in their teens and early 20s. Based on United States Census data, if 1% of men aged 18 to 24 had severe erectile dysfunction, that would translate to over 150,000 young men. Broadening the age from 18 to 44, there are over 500,000 young men with severe erectile dysfunction. This fifth slide depicts a study evaluating erectile dysfunction in teenagers. 40 young men in their teens who had erectile dysfunction were studied. Some had erectile dysfunction all their lives, so-called primary or lifelong erectile dysfunction. This study found that the number one risk factor for their erectile dysfunction was blunt perineal trauma, such as that which can occur from bicycle riding accidents or injuries. This next slide represents one of the conclusions of this publication. Usually, erectile dysfunction in an older person may be considered to be biologic-based, especially from artery blockage disease called atherosclerosis, with risk factors of diabetes, high blood pressure, coronary artery disease, obesity, elevated cholesterol. Men in their teens do not have such risk factors, and the tendency of healthcare providers is to conclude that erectile dysfunction in teenagers is primarily psychologic-based. We are now very aware that blunt perineal trauma, such as from bicycle riding, can also cause the same artery blockages that impair erectile dysfunction in older men with traditional risk factors. This study concludes a detailed vascular examination should occur in young men because they may have abnormal erectile function consistent with the vasculogenic erectile dysfunction seen in older men. These next series of slides review data on bicycle riding. The conclusion is many people ride bicycles. Of the 57 million people who ride bicycles, young bicycle riders comprise a large percentage of those who ride bicycles. The next slide emphasizes that boys aged 5 to 15 ride 4 times frequent bicycle trips than men 4 times the age of the boys and 6 times the age of the boys. The final slide shows that boys and men who ride bicycles have the potential to be involved in bicycle accidents. In various years, over 50 to 60,000 bicycle accidents were reported. It is well appreciated that only a fraction, say 10%, of bicycle crashes are ever reported. Thus, based on these data, there are over 500 to 600,000 bicycle crashes every year. This next segment of Video 7 will review a portion of an interview with Dr. Timothy Johnson, previously aired on a 2020 show and also shown on video number 5 of the series of videos on penile revascularization surgery for erectile dysfunction. This segment details the mechanism of blocked artery erectile dysfunction from bicycle riding.
All right, so here we have the pubic bone sitting on a typical bike seat. Show us where the arteries run on either side and how they can be compressed.
So right in here.
They literally come out, and if you press down like that, you're squeezing the artery. Clear as a bell.
About that. And it's both sides. So it's
either side. So the injury is typically bilateral. That is, it occurs on both sides?
That's correct. This is the bone you should be sitting on here.
Yeah. You want to be sitting up there, but in fact, what happens is it presses here.
You sit on this connector bone between here and here.
Right.
That's your pubic bone. That's the sit bone. Right. That's what you put your weight on. So when you put your weight on here, the artery gets squished.
Okay, put that artery in there one more time.
Oh, that red line there.
Yeah.
Or this China marker.
And put it right there, and you can imagine.
Break this thing.
Well, you can imagine how it's being compressed. Penile arteries usually bounce back to their regular round shape after they're compressed. But Dr. Goldstein speculates that repeated compression over time, as in riding on a bike seat for too long, can flatten and injure the arteries, thereby leading to blockages that may cause impotency.
You get hardening of the artery disease from injury to the lining. You usually get it from high blood pressure and cigarette smoking. They injure the lining cells. But here's a direct crush injury to the lining cells. So it either happens as immediate impotence, or what's even more scary, it's sort of like a time bomb. That's delayed impotence.
This next part of Video 7 will feature a phone interview with Sam, who had erectile dysfunction all his life, so-called primary lifelong erectile dysfunction. Sam only got help for his erectile dysfunction in his early 30s. Sam believes that a series of blunt perineal traumatic episodes while riding a bicycle as a boy possibly explained the blocked artery that was found to be the cause of his erectile dysfunction. During this interview, please be warned that there will be short, brief eyewitness videos of cyclists suffering a variety of blunt trauma episodes. The sole purpose of these eyewitness videos is to remind the viewer that there are likely more than 500,000 bicycle crashes every year. Some of these crashes may result in artery blockage, erectile dysfunction in both boys and young men. Hi everybody, we are so fortunate to have Sam here, who had erection problems essentially all his life. He was referred here by a doctor from New York because Sam actually is from New York. And I'm going to have Sam tell his story. First of all, Sam, thank you so much for doing this. Tell us just a little bit about growing up with erection problems and sort of what's that like?
Well, basically, I had the problems my whole life. When I was a teenager, I didn't really know that I actually do have a problem because I would get maybe semi-erections. You know, it was kind of a little bit hard, but not fully, maybe 40-50%. And for a long time, I thought maybe it's okay that it's like this and that it will get better, you know, if I'm with a woman. But then it never did. So then I would think that, oh, maybe it would be better if I meet someone I really like. And then it never happened again. It would still get maybe like 40% erections, 30 to 50%, and they wouldn't last long. And for a long time, I kept thinking that it's maybe, you know, I'm just not finding the right woman, or maybe I'm nervous, or especially since I would go see doctors, and other doctors would tell me that my issues are probably psychological because nobody could find anything wrong with me physiologically. They would all say you're healthy. So I was just kept searching and trying over and over, but it never worked. It was the same thing.
So ultimately, you kept going from doctor to doctor, and then you even had therapy done. But ultimately, you made it to a Dr. McCullough in New York. Is that correct?
Yes. I was seeing a therapist who thought that my problems were not psychological, and after doing a lot of therapy with him, he was saying that you're healthy psychologically, there's probably a physical issue with you, and then he referred me to Dr. McCullough, who's a urologist in New York. And then when I saw Dr. McCullough, he did a couple of initial tests, one being the
Okay, so you eventually make the trip down to San Diego. Now you're now in your 30s, and you've had erection
Yes.
problems essentially all your life. When
Yes.
when we find that the artery is blocked, the first thing we ask for is it possible that the artery got blocked from bicycle riding? So tell me about your bicycle riding history. It would have to be obviously at a young age because you've had this for so long.
Yes. I have had a couple of accidents when I was maybe 10 or 11 or 12 years old. I don't recall exactly, but I have fallen off the bicycle on a couple of occasions, and it has that metal road in the middle, so I have fallen off of it and hit on that.
Did you go see a hospital or did you go to a
No,
physician?
no, it wasn't. It wasn't a very a serious, huge impact. So I thought I'm okay, and I never really thought about it.
I know that's the scary part of this. We hear this all the time that you recall the fall, and you don't think it's a bad thing. And I guess it's just bad luck that it ends up injuring the artery. In any case, you don't have any other obvious reasons for trauma to the area and kicks and fights or falls or anything that would be more obvious than these bicycle accidents?
Not that I can remember of.
Okay, so eventually you underwent penile revascularization surgery. What was your experience with penile revascularization surgery?
The surgery itself,
Yeah.
I thought it's a complicated surgery and pretty extensive recovery period, but it worked, so it made a significant difference for me, so I'm very happy that I did it.
So tell me what you mean it works.
Well, I'm getting erections now, and they're pretty good, and I'm able to have a normal sex life now. Well, I'm finally fixed. I feel like I'm a normal person again. So
Awesome. That's awesome. What about the risks of surgery? Did you have any complications or?
No, I did not have any complications, but it is a kind of lengthy recovery process. You have to exercise a lot, you have to walk very long times, and you take painkillers, so it takes a while to recover, but it's very well worth it.
So if you knew a patient who had erection problems essentially all his life, who could not get a full erection, who fell on a bicycle bar like yourself, would you recommend going through this surgery?
Yeah, definitely would. I wish I had known about this procedure before, so that I didn't have to live through my 20s without being able to get erections. So I would definitely recommend this, and I just wish I knew about it sooner myself.
Sam, so listen, I greatly appreciate you doing this interview. It's not easy to talk about having a sexual problem. And by the way, thank you for speaking to so many patients who call you as they're seeking information. So twice I'm thanking you.
Sure.
You have a great day. Thank you so much for doing this. Okay, bye-bye.
Okay, sure. Okay, bye.
In summary, thank you for watching video number 7. I hope the eyewitness videos of the bicycle accidents were not offensive, but taken as educational. And thank you again, Sam, for doing the interview. Video 7 focuses on men with erectile dysfunction starting at a young age as a boy and continuing their erectile dysfunction through their teens, and in some cases continuing their erectile dysfunction into their being young adult men. All erectile dysfunction evaluations should be multidisciplinary and should engage biopsychosocial assessments. This video, number 7, focuses on the fact that some men with primary lifelong erectile dysfunction may have their erectile dysfunction from blunt perineal traumatic artery blockages to the penis, as can occur from bicycling accidents. Penile revascularization in appropriately selected patients can restore reliable erectile function in some patients with primary lifelong erectile dysfunction. Thank you.